both perpetuates and exploits inequality by prioritising those who can afford healthcare over those who need it. Privatisation has destroyed our healthcare system and is an antithesis to a community-based approach. The large number of people on medical cards, at 43% of the population, and the falling numbers of people availing of private insurance are all signs of an unaffordable system due to these privatisation policies. Privatisation has exacerbated the crisis of waiting lists in the public system across the country, and elderly people have literally been pushed aside to the margins. On trolleys and A&E corridors, living in emergency wards for months on end, unable to afford a place in a nursing home, with insufficient care packages, or for some, none at all. This is the most shameful aspect of the privatisation policies imposed by successive governments, a system that marginalises the most vulnerable. Elderly people have not only been dragged through numerous government policy changes over the years, but are the most vulnerable to those changes in the healthcare system. Age Action Ireland says it is those with the least means, often needing the most intervention and care, who are the current losers. It is clear that we must move away from a privatisation model towards a universal one, based on the need of services. The only way to achieve this is through the development of a primary care system with universal health care at its core. Unfortunately, this bill, although positive in its intention and for its recognition of carers, contains unrealistic expectations. Firstly, it assumes that a primary care system already exists, which could support the introduction of GP cards for those over 70. And secondly, it assumes a free GP card will be sufficient to meet the needs of people over 70. Research has consistently proven that primary care is the best system, both in terms of equal access and cost effectiveness. Strong primary care is associated with better population health, lower rates of unnecessary hospitalisations and relatively lower socio-economic inequality. Countries with strong primary care systems spend less on health care. However, Ireland is the only EU health system that doesn't offer universal coverage for primary care. There will be nearly 1 million people aged over 65 by 2031, an increase of more than 86%, or an extra 20,000 people per year. How can the government expect our current system to facilitate such an annual increase in the demand for our health services? And how can we expect GPs to alleviate the pressure on the top of existing costs and demands? GP care is central to the primary care model. In the words of Freeman and Moran, GP care represents a powerful means of alleviating the anxiety, discomfort and incapacity that come from sickness and ill health. GPs could provide a lot of outpatient procedures, tests and check-ups in primary care centres, moving patients away from hospitals and into our local communities, but only with adequate investment. In a primary care setting, GPs would essentially take a medical advocacy role, coordinating patient care according to the needs of the individual. While GPs are central to primary care, other healthcare professionals need to be supported too. Nurses, physiotherapists, occupational therapists, speech and language therapists and others all contribute to a community model of health provision. But structural issues exist which are not recognised under this legislation. Less than 20% of GPs work with more than 4 other GP colleagues in the same practice. This suggestion is not the norm for GPs to work alongside other health professionals. This work culture will make it difficult to establish a fully integrated healthcare system. While this bill attempts to respond to an ageing population, it has avoided responding to the changing profile of the GP sector. The sector is also ageing as younger doctors are emigrating or moving away from GP practice. There is a growing preference for flexible hours and early retirement, and an increase in the numbers holding vocational training. There is now a significant shortfall in geographical disparity in the supply of GPs, and health inequality is becoming an increasing worry. We are witnessing, especially in Donegal, a declining proportion of GPs working in rural areas. It was 33% in the early 1990s, and it's down to 22% in 2005. And in Donegal, there are only 48 GPs per 100,000 of population, compared to 64 nationally. So it is vital long-term planning and investment is therefore needed to ensure that our health service can sustain the pressure of an ageing population, as well as meeting the needs of those through all stages of their life cycle. The Government needs to prioritise the rollout of these proposed primary care networks and move away from damaging privatisation policies. Primary care has been talked about for over a decade, with very little results. The Government's report card on healthcare investment has shown there has been a failure to progress, and we still haven't seen a Primary Care Act, Primary Care Fund or recruitment of additional doctors, nurses and other professionals for primary care. It was envisioned that 400 to 600 primary care teams, 2/3 of the full requirement, would be established by 2011. But yet only 247 have been established 4 years on, and to date there are only 85 primary care centres in operation. It was envisaged that there would be 90 primary care networks across the country, each with about 4 or 5 primary care teams, essentially acting as a one-stop shop providing a wide range of health services at a local level. The Minister recently announced that 17 integrated service areas were being replaced by 9 community health organisations, and that existing resources will be reorganised into 90 primary care networks. But we still don't know what the status of those primary care networks is. Many organisations representing elderly people have been critical of the pace of development of primary care health centres and health teams. Unfortunately, at this late stage, moving towards a community-based approach will take time, as large-scale structural reforms need to take place. According to the National Association of GPs, we are so far away from achieving this model that it is too late for the current government to make any changes in time for the next election. And it won't be until the middle of the next government when we might see some changes being made. So instead of using the elderly population as political capital in time for the next election, why not use the funding, time and resources to invest in a primary care infrastructure so that universal health care can become a reality for all? The bill is naive in assuming that GP cards given to all over 70s means their needs will be met. It presumes that our current system is highly developed, with enough GPs and a fully comprehensive health system to address the complex nature of elderly health needs. The principle makes sense, but the bill is misleading. Yes, people are often put off going to the doctor because of costs. And yes, those who have a GP card tend to visit the GP on average 2 more times per year, meaning overcrowding in emergency departments may ease. But a GP card will not grant over 70s access to the wide range of community services available under a medical card. A GP card does not cover hospital visits, community health services, dental services, prescription medicine costs, hospital care, optical or oral services, social work services and community services. The IMO has expressed concern that GP cards are seen as an alternative to medical cards when the two are not compatible. What use would a GP card be to someone over 70 whose visit is paid but whose further needs will come at a cost? And if we were being cynical, we might assume that maybe the PCRS will use the fact that over 70s have GP cards as a way of reducing the number of medical cards attached to over 70s. I envisage that more elderly people will visit the doctor, the more treatment people will need, and the more they will need access to primary care services, which they currently can't afford or can't access. Could this mean that the quality of GP care to patients across the population will decrease as a result of the cyclical pressure? Already our community-based services can't meet demand from elderly people for supports to live in their own homes and communities, and there has been a lack of capital investment to replace or refurbish community nursing facilities. It must be made clear that a GP card does not mean universal health care, and it is not correct to say that universal health care means only a free visit to the doctor. The two should not be confused. Today, Minister, there is no right to health in the Irish Constitution or through any statutory provision, even though Ireland is a signatory to Article 12 of the International Covenant on Economic, Social and Cultural Rights, which recognises the right of everyone to the enjoyment of the highest attainable standard of physical and mental health. Universal access to health care on the basis of need must be recognised in our legislation as a right for all citizens before it is at risk of privatisation again. Only recently, Minister, you imposed a deadline for those under 34 years of age to acquire health insurance. And we saw government proposals to increase nursing home charges for elderly people using community-based services. And we even seen yourself appearing in advertisements for the private health companies encouraging people to take out private health insurance. How does this equate with a commitment to a universal healthcare system? These are worrying developments, and they signify the possible privatisation of our full healthcare system in the future. In the meantime, doctors and patients do not want to see another primary care strategy or a mini primary care strategy. We all want to see a structured, reliably funded investment programme for GP practice so that our primary care system can be developed. Building primary care clinics does not equate to the development of integrated primary care services, nor does the number of team meetings happening indicate progress in this regard.
Thank you.
Only the health of our patients will indicate this government's progress.
Now call Deputy Michael Fitzmaurice.